Hi everyone. I am here for today's Insta live chat with my special guest today. I'll be talking about gut health. We all understand that taking care of the gut is very, very important because there are a lot of health issues, diseases that are associated with gut problems, and a lot of people suffer from gut issues which they don't even realize that itself, they need to consult a doctor, they need to discuss about those issues and sort them at the right time. March is also marked as colorectal cancer awareness month, and taking care of the gut is also important in preventing higher chances of colorectal cancer. So today I'll be discussing about gut health with my today's expert, Dr. Vivek Mangla, who's the Senior Director for Gastrointestinal and HPV at Max Hospitals, Parparganj and Vaishali. So I would now like to add Sir to the live chat. Yes, sir. Yeah. So hi, sir.
Hi, Dr.
Thanks for sparing
Mahima.
time on a Sunday.
Yeah, always a pleasure.
Great, sir. सो सर, गट हेल्थ बहुत ही इंपॉर्टेंट टॉपिक है. अक्सर ऐसा रहता है कि लोग बहुत ज्यादा फोकस गट हेल्थ पे नहीं देते हैं, एंड वी अंडरस्टैंड कि गट हेल्थ का कहीं ना कहीं जीआई हेल्थ इश्यूज के साथ एक रिलेशन है. सो वी वांट टू नो अ लॉट अबाउट गट हेल्थ फ्रॉम यू. सो इफ यू आर रेडी, आई विल स्टार्ट विद माय
Yeah,
क्वेश्चंस.
sure.
ओके, ग्रेट. सो सबसे कॉमन गट हेल्थ इश्यूज क्या है, इफ वी टॉक अबाउट दैट स्पेसिफिकली इन द इंडियन कम्युनिटी?
Uh, so, अगर हम इफ यू टॉक अबाउट द गट हेल्थ इश्यूज, तो बहुत ज्यादा अगर हम लोग देखते हैं तो उसमें इंडाइजेशन, हार्ट बर्न, कुछ लोगों को कॉन्स्टिपेशन, एक सेंसेशन की मोशन पूरा क्लियर नहीं हुआ है, एंड ओकेजनली पेशेंट्स विल हैव सम ब्लीडिंग इन द स्टूल्स, दैट इज मोशन में कभी ब्लड आना. दीज आर कॉमन हेल्थ और गट हेल्थ इश्यूज दैट वी वुड सी, एंड दीज वुड बी सीन वेरी वेरी कॉमनली इन द कम्युनिटी.
राइट. एंड लोगों को ऐसा लगता है कि ये तो नॉर्मल है. दे समटाइम्स फील कि हाँ, ऑन एंड ऑफ इस तरह के इश्यूज होना, हाँ फाइन, इट्स नॉर्मल. सो व्हाट इज अब नॉर्मल एंड व्हाट इज नॉर्मल?
तो दिस इज अ वेरी इंपॉर्टेंट, जी आपने बहुत ही महत्वपूर्ण एक सवाल पूछा है. वेरी इंपॉर्टेंट क्वेश्चन देयर, दैट lot of gastrointestinal symptoms would be kind of taken as these are part and parcel of daily life, or most often what would be seen is that there will be digressions in the diet. You normally eat a healthy balanced diet, but you go to a party, you uh, go to a marriage, and then you overeat, and then you will have occasionally have bloating, some sense of fullness of the abdomen, and all these things. So symptoms which are usually happening occasionally, they would generally not be that sinister. So symptoms which are happening, which are persistent, or specifically symptoms which are worsening, or sometimes what we would see is with the same lifestyle, you've started developing having a new symptom. Say, for example, somebody who's 50, 60 years of age who never had constipation develops a new onset constipation. Somebody who used to go, say, for example, once a day, now starts going 3 to 4 times a day to stool, doesn't feels that the stool is not clearing off in one go. This is something which is abnormal. Presence of stools is never normal. It is generally a sign of some disease. It may not be cancer or a polyp. It could just be hemorrhoids. But then we need to be able to understand that symptoms which are persistent and symptoms which are worsening, they definitely need to be looked at.
राइट. राइट. एंड अगर हम बात करें रिलेशनशिप ऑफ गट इश्यूज विद जीआई कैंसर्स, तो क्या कुछ इस तरह के गट इश्यूज हैं जिनसे जीआई कैंसर्स डेवलप होने का लेटर ऑन इन फ्यूचर ज्यादा चांसेस हो जाते हैं?
सो अगर हम इस क्वेश्चन को अगर हम आंसर करते हैं तो आई डिवाइड इट इनटू पार्ट्स. सो फर्स्ट थिंग इज, व्हेन वी टॉक अबाउट गट इश्यूज, इट इज अबाउट वी कुड टॉक अबाउट सिम्टम्स एंड देन देयर रिलेशन विद जीआई कैंसर. सो अगर हम पेट के सिम्टम्स की बात करते हैं तो समझने की चीज ये है कि जितने भी जीआई कैंसर्स हैं उनके जो अर्ली सिम्टम्स होते हैं, दे आर कॉमन विद नॉन कैंसरस कॉजेस. तो इसको तो अनलेस द पेशेंट प्रेजेंट्स टू द डॉक्टर एंड द डॉक्टर इवेलुएट्स, it is very difficult to diagnose them early unless the patient has persistent symptoms and gets himself or herself evaluated. When we talk about gut issues and specific gut diseases, yes, there are some diseases with which we know there is an increased risk of cancer. For example, starting from the upper intestinal gastrointestinal tract, food pipe or esophagus, which is the first part of the digestive system. अगर किसी को chronic reflux रहता है, if somebody has a chronic reflux disease, then this can lead to development of cancer over a period of time in the food pipe or the esophagus. Chronic gastritis, chronic infections in the stomach, H. pylori infection can lead to both lymphomas, which is a type of cancer, as well as other type of cancer, which is adenocarcinoma. When we talk about gut, it also includes our entire digestive system, including the liver and the pancreas. Two diseases, one chronic hepatitis and cirrhosis, which affect the liver, जो कि एक लिवर में लगातार इंजरी किसी भी कारण से, which could be alcohol, which could be hepatitis B, hepatitis C, इनकी वजह से सिरोसिस होने से, या फिर किसी को chronic pancreatitis किसी कारण होने से भी कैंसर का रिस्क बढ़ता है. We go further down the digestive tract, कोलोरेक्टम यानी लार्ज इंटेस्टाइन की अगर बात करें तो उसके अंदर पॉलिप्स और इन्फ्लेमेटरी बाउल डिजीज, जैसे कुछ पेशेंट्स को अल्सरेटिव कोलाइटिस रहता है. ऑल दीज गट इश्यूज कुड और गट डिजीजेस could lead to an increased risk of cancer. Now, important thing for us to give out a message clearly here is that not every gut issue means cancer. So we see a lot of patients who are very worried about their gut symptoms, then they get themselves evaluated. Important thing to understand is that there is always an overlap between gut symptoms which are there in patients who have kind of not worrisome problems or something which needs more attention. And the best way to sort out or answer this question is to get oneself evaluated first by a doctor and then doing the prescribed tests.
Right. So now my next question would be about those tests. So अगर हम बात करें, what would be those regular testing that one needs to get done, maybe on regular basis to rule out any gut issues or to rule out any early signs of GI cancer. So वो tests क्या क्या हैं जो एक जरूरी टेस्ट हैं जो आप recommend करेंगे?
So अगर हम रूटीन रिकमेंडेड टेस्ट की अगर हम बात करते हैं तो apart from routine blood tests, there aren't, for the general public, we are talking about somebody who doesn't have an increased risk of GI cancer because of some reason, which I'm going to allude later in my answer to this question. तो अगर हम routinely बात करते हैं तो जो रूटीन टेस्ट होंगे वो सिर्फ सिंपल ब्लड टेस्ट रहेंगे. किसी भी व्यक्ति को अगर कोई भी सिम्टम्स नहीं है और उनको कोई एडिशनल रिस्क फैक्टर नहीं है तो उनको इसके बियॉन्ड रूटीन टेस्ट इंडिया में रिकमेंडेड नहीं है. अगर हम वेस्ट की बात करते हैं तो वेस्ट में पहले 50 इयर्स बोलते थे, आज के दिन वहां पे 45 इयर्स की एज के बाद एक रूटीन स्क्रीनिंग कोलोनोस्कोपी की रिकमेंडेशन रहती है. मोस्ट इंपॉर्टेंट थिंग हियर इज टू नॉट इग्नोर सिम्टम्स, कि अगर किसी को भी कोई सिम्टम्स हैं तो उसे इग्नोर नहीं कर कर उन सिम्टम्स के ऊपर टाइमली एक्ट कर कर इवेल्युएट किया जाए ताकि कि हम बीमारी को समय से पकड़ सके. नाउ विल टॉक अबाउट पीपल हु हैव some increased risk factors. Say for example, किसी को ऑलरेडी एस्टैब्लिश्ड रिफ्लक्स डिजीज है जो अनट्रीटेड है या रिलेटिवली अनट्रीटेड है, उनका एक एंडोस्कोपी होना. पेशेंट्स जिनको क्रॉनिक हेपेटाइटिस है उनके अंदर रेगुलरली हेपेटाइटिस बी और सी के लेवल्स चेक होना और उसके साथ रूटीन लिवर टेस्ट, and then some tests which are routinely recommended would sometimes include an ultrasound, and in select high risk groups even a CT scan would also be recommended. When we talk about the remaining gastrointestinal tract, for example colorectum, अगर किसी को इन्फ्लेमेटरी बाउल डिजीज एग्जिस्ट करती है तो उसका एक टाइम बाउंड कोलोनोस्कोपी रेगुलरली होना है, चाहे उनके सिम्टम्स बिल्कुल कंट्रोल्ड चल रहे हो तब भी. नाउ वी कम डाउन टू स्पेसिफिक एरिया जिसकी अगर हम आज बात कर रहे हैं, कोलोरेक्टल कैंसर अवेयरनेस मंथ का आज लास्ट डे भी है 31 मार्च. तो कोलोरेक्टल कैंसर जो है उसकी अगर हम अर्ली डायग्नोसिस या स्क्रीनिंग की बात करते हैं तो उसके स्क्रीनिंग टेस्ट में एक स्टूल फॉर अकल्ट ब्लड यानी मोशन में ब्लड की जांच करना रहता है, और एक मोर स्पेसिफिक और मोर वैल्यूड एंड इंपॉर्टेंट टेस्ट इज द टेस्ट ऑफ कोलोनोस्कोपी. अगर हम कोलोनोस्कोपी की बात करें तो अगर हम एसिम्प्टोमेटिक व्यक्ति की अगर बात कर रहे हैं कोलोनोस्कोपी कराने की तो वो उसको कराने की जरूरत है जिसकी फैमिली में फर्स्ट डिग्री कोई रिलेटिव है यानी माता पिता भाई बहन, तो उसको कोलोनोस्कोपी कराने की जरूरत है. जिसकी जो स्टार्टिंग एज होती है वो कहा जाता है कि अगर परिवार में से फॉर एग्जांपल किसी को 50 इयर्स की एज में कैंसर हुआ तो जो उनके सिबलिंग्स हैं उनके बच्चे हैं उन्हें 40 इयर्स की एज में स्क्रीनिंग कोलोनोस्कोपी करा लेनी चाहिए. उसकी जो फ्रीक्वेंसी है वो इस पे डिसाइड होती है कि पहली कोलोनोस्कोपी पे क्या फाइंडिंग्स आ रही हैं एक, और क्या कोई जेनेटिकली आइडेंटिफाइड सिंड्रोम तो नहीं है जिसकी वजह से हमें एनुअल स्क्रीनिंग टेस्ट की जरूरत तो नहीं है.
राइट. और जब हम प्रिवेंटिव हेल्थ चेकअप की बात करते हैं, मोस्ट ऑफ द टाइम्स गट हेल्थ के रिलेशन में कोई इस तरह की आई थिंक कि बहुत ज्यादा वेटेज नहीं दिया जाता है व्हेन पीपल गो फॉर रेगुलर पीएचसी चेकअप्स. सो आई थिंक बहुत जरूरी है फॉर पीपल टू अंडरस्टैंड कि अगर आपको कुछ भी इस तरह के सिम्टम्स लगते हैं, इट इज इम्पोर्टेंट कि आप राइट टाइम पे जाके अपनी डॉक्टर से कंसल्ट करें. एंड अगर आपका फैमिली हिस्ट्री है, यू हैव टू बी इवन मोर कॉशियस सो दैट इट कैन बी डिटेक्टेड एट एन अर्ली स्टेज. Or
So,
since colorectal cancer awareness month here, so we would also like to know what are those early signs that one needs to be careful for.
before answering this question, I'll just go one step back
Yeah,
and talk about in a preventive health checkup.
yeah,
I think one factor which we quite often see is missing is a doctor visit. What we see is people just getting that blood work done,
yeah.
and then without any talking to a healthcare professional or a healthcare provider, those tests would be ordered, and then those tests would be interpreted without any clinical background being there.
Yeah.
So very important that a doctor visit or a consult is part of that preventive health checkup, wherein अगर किसी को कुछ सिम्टम्स चल रहे हैं तो वो सिम्टम्स वो डॉक्टर को बताएं, और उसके हिसाब से अगर डॉक्टर कोई एडिशनल टेस्ट बता रहे हैं तो उन टेस्ट को किया जाए. नाउ आई कम टू आंसर द क्वेश्चन दैट यू आस्क्ड फॉर अर्ली कैंसर के. अगर सिम्टम्स की बात करें कोलोरेक्टल कैंसर की, तो मोशन में थोड़ा थोड़ा ब्लड आना, बावल हैबिट्स चेंज होना. फॉर एग्जांपल किसी को मैंने आई ऑलरेडी टोल्ड somebody passed used to pass stool once a day, now starts passing stool twice or thrice a day. We used to clear his bowels in one go, feels that the bowel is not completely empty, needs to go repeatedly. Presence of blood in stools, as I said, is never abnormal, but presence of blood which is mixed with stools is definitely abnormal. It is extremely unlikely to be because of piles or hemorrhoidal bleed. Generally speaking, when we talk about cancers, a lot of people talk about weight loss, anorexia की भूख कम हो गया, वजन कम होने लग गया. Unfortunately, ये symptoms इतने ज्यादा entrenched हैं mindset में that we see a lot of late diagnosis because of this, कि इस patient को तो भूख ठीक है, patients have kind of that kind of a thing, मुझे तो बस थोड़ा सा constipation है, मुझे तो कभी कभी bleeding आता है, डॉक्टर्स बोलते हैं, मैंने अपने family doctor को दिखाया है, बोलते हैं piles है, मेरे को टेस्ट कराने की जरूरत नहीं है. इट इज इंपॉर्टेंट टू अंडरस्टैंड दैट अगर किसी को बार बार पेट में दर्द हो रहा है या वो बढ़ रहा है, सिम्टम्स वर्सन कर रहे हैं, सिम्टम्स परसिस्ट कर रहे हैं, so these are very important symptoms which need to be picked up, and then the person has to get himself or herself evaluated to get a proper diagnosis. कैंसर डायग्नोसिस करना एक पार्ट है, हमें ये चीज समझना कि कोई भी सिम्टम है उसकी क्या एक्सप्लेनेशन है और उसको कैसे ट्रीट करना है वो एक और इम्पोर्टेंट पार्ट है. इस चीज के दोनों एस्पेक्ट्स बहुत ही इंपॉर्टेंट है.
Right, absolutely. I totally agree with it. और I think early detection बहुत जरूरी है because if we detect it at an early stage, obviously the chances of proper cure increases. So बहुत लोगों को ऐसा लगता है कि सर GI कैंसर है तो वो ट्रीट नहीं हो सकता है या फिर वो क्योरेबल नहीं है. So आप अगर you would like to share more thoughts on that is GI are GI cancers curable? If yes, then which ones are the most curable?
So if we talk about GI cancers, Dr. Mahima, I'll just say that cancers affect every part of the digestive system, starting from food pipe to the stomach, to the liver on the right side, gallbladder, the bile ducts, the pancreas in the center of the belly in the back part, and then the entire small intestine and large intestine. So each cancer affecting the different part of the digestive system has different symptoms. It has a different uh, how should I say, evaluation, investigations would also be different for these, and the outcomes of treatment would also be different. Since we have colorectal cancer more in focus today, I would like to say that when we talk about colorectal cancer, this is one cancer which is the most preventable cancer affecting the digestive tract. That is one. And most importantly, it has the most effective treatment and the best cure rates. So when we talk about any cancer, हम stages की बात करते हैं. अर्ली स्टेज कोलोन कैंसर, रेक्टल कैंसर, स्टेज 1 और 2 में 90% से भी ज्यादा क्योर रेट्स रहते हैं. एंड इवन स्टेज 4 यानी कि फैली हुई बीमारी, यानी कि जिस पेशेंट को डिजीज कोलोन से स्टार्ट हुई और से फॉर एग्जांपल लिमिटेड लिवर या लंग्स या एब्डोमेन में गई है, उसके अंदर भी वी टॉक अबाउट क्योर्स आल्सो समटाइम्स. एंड मोस्ट इंपॉर्टेंटली, इवन इफ वी कैन नॉट क्योर द डिजीज, वी कैन गिव दीज पेशेंट्स वेरी मीनिंगफुल सर्वाइवल. सो अगर हम स्टेज 4 कोलोरेक्टल कैंसर की बात करें जिसमें वो डिजीज सर्जरी से रिमूवेबल नहीं भी है, then also with modern medical treatment, majority of the patients are going to survive 2.5 years or more. many of these would survive even 5 years and more. And अगर किसी patient को, for example, we have lots of such patients जिनको कि एक just एक rectal tumor था, उसके साथ एक liver में tumor था, they were treated with multimodality treatment in which जो liver में tumor था वो भी निकाल दिया गया है, and those patients are alive 5 years 10 years. Important thing is regular follow up होना है, and उसके appropriate जो भी tests होने हैं, ताकि अगर कुछ disease दिख रहा है उसे टाइमली अग्रेसिवली ट्रीट करें तो अच्छा है. अगर हम बाकी सब डाइजेस्टिव ट्रैक्ट कैंसर्स की बात करते हैं तो फूड पाइप कैंसर वुड बी द नेक्स्ट बेस्ट कैंसर टू ट्रीट, फॉलोड बाय स्टमक कैंसर, फॉलोड बाय liver cancer, and then pancreas and gallbladder. Unfortunately, the pancreas and gallbladder cancers still, we have a lot of work to do still in these areas. We still are not there in terms of giving very, very good survival outcomes. But yes, a significant proportion of these patients, especially if they are diagnosed timely, can be cured. I think the most important message that I would like to give today is that if there are symptoms, we do evaluation. And if the test picks up something, we act on it. Because when we talk about cancers, it is very easy and should be easy to understand that you pick up a cancer in stage 1, you are going to have a very, very high survival. You pick up a cancer in stage 4, that is advanced disease, the disease has spread, the patient's condition has run down. We're obviously not going to have that good survival outcomes in these two different set of patients. So stage 1 and 2 is where we have to target to diagnose these cancers, and that is what is going to help us a lot. When we talk about colorectal cancer, a colonoscopy is the best investigation, because a CT scan, even sometimes patient will come, मेरा तो डॉक्टर साहब CT scan बिल्कुल ठीक है, आप फिर क्यों मुझे बोल रहे हैं कोलोनोस्कोपी कराने के लिए? वी हैव टू अंडरस्टैंड that colonic cancer starts from the inner lining of the intestine, and colonoscopy is the test which is going to first tell you about the cancer and quite often about the precancerous stage. So there is a precancerous stage of colorectal cancer, which is a polyp. You remove that polyp and you are preventing a cancer, and because this cancer, if it was not diagnosed, this could lead to a cancer death. So that is what we have to understand.
So very important for people to pay attention to their body and especially the gut health.
Absolutely, absolutely, absolutely. I totally agree to that.
So gut health की हम since बात करें, तो what would be the best way to take care of the gut? What would be your advice?
So, one is there would be multiple parts of it. One is eating right. In today's time, we see a lot of fast food, processed food. We Indians have to understand that the West has seen all this. They've faced the brunt of it, and now they're trying to change their diets back to fruits, vegetables. We see big food corporations in the West being sued, class action suits, and they ending up paying a lot of money as compensation. We are trying to follow the Western lifestyle still. Next important thing is exercise. Third important thing would be moderation. And actually, recent WHO report states that even small amounts of alcohol intake can lead to an increased risk of cancer. But we know one thing for sure: occasional intake may not be that harmful, but a regular daily intake of alcohol, especially more than a certain amount, is definitely a risk factor for both pancreatic cancer as well as liver cancer. Another important thing that we can do is taking a lot of fresh fruits, incorporating exercise, reducing the stress, having some deep breathing, some yoga, some exercise in the routine. This will also help bring down the risk of cancers of the gastrointestinal tract. These are very important.
Wow, interesting. So I think very important for people to regularly take care of the gut by following these simple points that you've mentioned. Sir, अब हम बात करेंगे myths versus facts की, because there are a lot of times लोगों के mind में they think कि नहीं, ये तो सिर्फ myth है, it's not true. So अब मैं आपसे पूछूंगी, सबसे पहला है chronic constipation. We see a lot of Indian population having constipation issues. So क्या chronic constipation can increase chances of developing GI cancers later on in future?
So when we talk about chronic constipation, we have to understand that मेडिकल साइंस की जो डेफिनेशन है कॉन्स्टिपेशन की, वो कहते हैं एक दिन में 2 से 3 बार से लेकर 7 दिन में एक बार भी मोशन होना इज नॉर्मल. A lot of it is about the Indian mindset wherein if somebody doesn't pass stool every day, उनको लगता है कि उन्हें constipation है. So one thing is that we have to get this out of our mind. Constipation lasting for a long period of time, once you have evaluated it, you've ruled out that there is no polyp, there is no tumor which is causing constipation, would generally not lead to an increased risk of cancer. Important to understand is if somebody is having persistent constipation or a worsening constipation, appropriate evaluation has to be done. to rule out cancer as the cause of that constipation.
Hmm.
So chronic constipation per se is not a risk factor for cancer, but it could be a manifestation of cancer, is how I would put it.
Interesting. What about food allergies? We also see it's neglected in India. We see that people don't regularly go for food allergy test, but बहुत बार ऐसा होता है कई लोगों को certain food items की allergy होती है और because उन्हें मालूम नहीं होता है वो फिर भी वो food item consume करते रहते हैं. सो फूड इंटॉलरेंसेस हैं या फिर एलर्जीज हैं तो क्या वो लोग जिनको फूड एलर्जीज है या फूड इंटॉलरेंस है तो क्या उन केसेस में डज इट अगेन इंक्रीज द चांसेस ऑफ डेवलपिंग जीआई कैंसर्स इन फ्यूचर?
So if we talk about food allergies, so there would be a lot of variation in the allergies that these people may have. So when we talk about India, what we see is some bit of milk intolerance, which is also called lactose intolerance, and to some bit we would be talking about
Gluten
wheat allergy.
intolerance
Yeah,
also.
yeah, this is what exactly I was. Wheat allergy, in which the allergy is to a protein component called gluten in the wheat. So when we talk about these two specific conditions, there is no clear association between these and cancer. These will cause symptoms, but then these symptoms will, uh, the challenging part is that sometimes we see the other side of it. Say, for example, the patient is having some symptoms which are genuine symptoms which need evaluation, and that person is ascribing these to the food allergy. So this is also important to understand that the food allergy test, if you ask me medically, the food allergy test has never been shown to be kind of a very, very great or a very, very useful test in terms of helping guide the management. Yes, somebody is having digestive tract symptoms. We are not being able to figure out a clear cause. Yes, in those patients, the food allergy test would help us kind of figure out that this could be the possible offending thing and this could be avoided. Sometimes people will have extremes of these food allergies. Say, for example, people who have an extreme kind of a gluten sensitivity, they will develop a generalized systemic kind of a picture. They will develop rashes when they take gluten. They will develop sometimes joint pains, severe neck pain, severe headaches. So this is a group of patients in which we would be like more like that. And quite often, what we realize is that people themselves sense that yes, this is probably the food which causes them problems, but sometimes they would end up taking it because of lack of options, and that's when they will have their symptoms. So, per se, to summarize, food allergies and symptoms are more often kind of labeled as food allergy, which needs to be properly evaluated. And second, food allergies which generally do not lead to an increased risk of cancer in most scenarios.
Okay, lovely. What about eating outside food? So, does that increase chances of developing GI cancers in future? जिन लोगों को आदत होती है कि उनको घर का खाना खाना ही नहीं है, बाहर से ही खाना खाना है, बाहर जाके खाना है. What about that?
So I think what you say is equally applicable at my home as well. My son, you give him an option of home food versus outside food, it's always outside food. I think the important thing for us to understand is that uh, outside food is something which we quite often say that it's bad or it's good. The important thing to understand is that you can get healthy food outside as well. The food hygiene has to be there. Unfortunately, in India, there are a lot of governmental or health societies controls, but still you see a lot of lack of hygiene in food. So that is a major challenge when you're eating outside food. A well prepared meal which does not use much of preserved food items. Now, preserved food items are known to increase the risk of stomach as well as food pipe cancer or esophageal cancer. So we should avoid preserved food as far as possible, be it home, be it outside. Now, in India, what we see is eating out, or now what we see a lot more happening is ordering outside food inside the home. Now, that is
Yeah.
some trend which is happening a lot. Unfortunately, most of it is processed, heavily processed food. You'll have people eating raw carbohydrates, absolutely starch foods, pizzas, burgers, in which there would be very little veggies, very little fresh. Even if there are some vegetables, they would quite often be preserved. The patty of the burger is going to be preserved. So this is what we have to kind of avoid. You will get a good freshly cooked rice outside. You'll get a nice bowl of curd or dal. That's good healthy food. You'll get a fresh green salad. But unfortunately, the Indian family, when it goes out, hardly ever orders a salad. Now that's a challenge.
Yeah. Sir, also since we are talking about, preservatives in the food, which increases chances of these kind of issues, what about eating in plastic food containers or drinking water in plastic bottles? तो जो plastic usage रहता है kitchen में और हम generally देखें तो lot of people also use plastic containers for heating in the microwave या फिर microwave utilization की भी हम बात करें कि warming food करना है तो हमेशा microwave में food warm हो रहा है उसका गट हेल्थ से या फिर चांसेस ऑफ गेटिंग जीआई कैंसर्स इन द फ्यूचर से क्या रिलेशन है?
Dr. Mahima, we have to understand that a part of this could be myth, but a part of it, if you ask me today, is actual lack of scientific evidence to support or refute what you say. So, in the sense, when we talk about plastic, so generally speaking, heating food in a plastic container, it generally makes very little sense in general. Let's not talk scientific evidence here, but you're heating something in which there is plastic. You heat a plastic, it emanates a smell, it burns when you heat it. So this is something which you would generally, common sense says that we should prevent. As far as we are concerned, there is a very recent study which showed that people found uh, small nanoparticles of plastic in the bloodstream of people. Now, the harmful effects of this,
Yeah.
we may not know today, but then over a period of time, I think these are going to reflect up. And I think somewhere along the line, as we are kind of moving ahead, we are realizing that some of the traditional eating practices in the country, eating food before dark, freshly food, not eating too much of preserved food, not keeping food in refrigerators for long and then having it. Now, all these things, there is a lot of evidence also now building up which says that this is one thing that probably some part of our traditional food habits, probably we need to get them back into our eating routines rather than just going ahead with what the West was following. Because I can tell you, and anybody who's traveled abroad would agree, that you go outside, you'll see most people eating lots of fresh salads, there being a lot of impetus on fresh foods, and there being a lot of information that you should avoid colas, preserved foods, excessive sugars in the diet, which can lead to obesity. They can lead to an increased risk of cancer. And more importantly, when we talk about obesity as a concern,
Yeah.
obesity poses many problems. One is that in itself it leads to an increased risk of cancer. The other side of the problem is that quite often with obesity, what we see is that people who have difficulty moving about, they are not physically active, and when they're not physically active, so God forbid they develop a problem, they develop a cancer, their treatment possibilities become even lesser. So we'll have, say, for example, a 45, 50 kg gentleman breezing through surgery, breezing through his treatment, whereas somebody who weighs 100, 110 kgs is struggling actually to treat it. The in traditional Indian mindset that healthy hai, mota hai to halka acha hai, that probably is something that we need to really look at.
Right. So I think weight also plays a very big role in prevention of cancer.
Yes, absolutely. And treatment that is possible, and the treatment outcomes as well.
राइट सो आई थिंक व्यूअर्स अपने वेट का खास ध्यान दें बाहर का खाना जितना भी टेम्पटिंग लगे कम से कम खाएं एंड प्रेफरेबली लेट्स गो बैक टू आवर बेसिक्स आवर रूट्स कि हम घर का बना हुआ खाना फ्रेश खाना जितना खाएं उतना हमारे लिए ज्यादा अच्छा है सर ऑल्सो आई एम गोइंग टू टॉक अबाउट सर्वाइकल कैंसर वैक्सीनेशन so we have heard that cervical cancer vaccination का जो पूरा promotion है it's all about women should take it but is it true that it should also be taken by men and it has a role in preventing colorectal cancers?
So when we talk about HPV vaccine or the cervical cancer vaccine, it is essentially a vaccine which is kind of given to prevent infection by a particular virus which is called human papilloma virus. Now, we also have to understand that in India, majority of the cancer of the cervical, of the gynecological organs and cervix in particular is related to HPV virus. We are now realizing that the same viral infection is contributing to a lot of head and neck and oral cancers. And there is a specific type of anal squamous cancer, which is the bottommost part of the digestive tract, which is also affected by the same virus and could be affected by the same virus related cancer. Now, when we talk about cervical cancer, the incidence of HPV infection and cervix, the incidence is much higher. When we talk about men, the cancer, squamous cancer of the anal tract, which is specifically related to HPV, would be seen more often in people who are engaged in anal sex, or more in homosexual individuals, because of the reasons which are obvious. And oral cancers, which we see related to HPV, also tend to happen a little more often in this subset of people. So to summarize, when we talk about cervical cancer vaccine, the HPV vaccine, it has very, very limited role or practically no role in preventing a colorectal cancer. It can prevent some oral cancers and anal squamous cell cancers if they are related to HPV infection.
Right. Is there any other special vaccine that one can take to prevent any form of GI cancers?
So when we talk about GI cancers and prevention, the hepatitis B vaccine is one vaccine which now the government, the health organizations, everybody is now routinely recommending these vaccines. The first dose in today's times is given at birth or sometimes at 1 month of age. Now, important to understand is that before 95, 96, very few people had taken this vaccine. So you've got a big adult population who's not been vaccinated, who, especially if they're at a higher risk, say for example they have cirrhosis, they have some other coexisting liver disease, they should take that vaccine. When we talk about anybody who's born after 97, 98, 99, they would generally have received that vaccine, and if not, they could be considered for vaccination. Apart from that, unfortunately in today's times we do not have any vaccine which can prevent GI cancer from happening, and probably this is something which is a work in progress. Some work is happening on this, but then when we talk about GI cancers, we know that every part of the digestive tract has a different cancer, different causation, not exactly an infective kind of a etiology or cause, and that is why probably development of vaccines in this area is lacking.
Right. So what would be your final takeaway message to give to the audience in terms of taking care of the gut health?
So I think I could just say a few points on that. Eat healthy, adopt a healthy lifestyle, incorporate some exercise, regular sleeping hours, and most importantly, do not ignore a symptom. What we see is people having some symptoms, taking medicines of their own from a doctor, and then not getting themselves evaluated. When being told to get tests done, they have a lot of misconceptions about why these tests are being ordered. I think the tests are a way of which tell a doctor, it gives the doctor an opportunity to peep inside your body, what's happening, to understand better. And symptoms is a way of our body telling us that there is something happening inside. It needs to be attended to. We should not just treat the symptoms on the basis of the symptoms that you are treating the symptoms. We have to try and figure out the underlying cause. Last but not the least, when we talk about gastrointestinal tract cancers, they are definitely curable. And when we talk about colorectal cancer, it is the most preventable and curable gastrointestinal tract cancer. We have published 2 articles today in Hindustan Times City in the east side of Delhi, Noida, and Ghaziabad. If people can reach out, read those articles, they can reach out to us. We have will by evening they'll be put on our Instagram as well. They can read those articles. They have a lot of valuable information about how we can prevent, how we can treat, and what are the results of modern day treatment for these colorectal cancers.
Lovely. So, once again, for our viewers, Dr. Vivek Mangla is the Senior Director for GI and HPB Surgical Oncology at Max Hospitals, Parparganj and Vaishali. So, sir is available in case anybody is interested to go meet him, consult him, or you have any family member who's going through any sort of GI issues. Please don't forget to consult Dr. Vivek Mangla. I personally recommend him. He's one of the best doctors.
Thank
So,
you,
sir,
Dr.
thank you.
Mahima.
Thank you so much for sparing time. It was lovely chatting with you.
Thank you, Dr. Mahima, and I thank all the viewers for staying with us. And I really hope if we are able to just get this bit message across that we should not ignore our symptoms, I think this time spent would be worth it. Every colorectal cancer prevented is a life saved. I think that's the important thing. We detect a polyp. We are so happy that we've taken out that polyp and the cancer is prevented. Lot of expensive treatment is prevented, and that's what motivates us in doing all these awareness activities around this cancer. Thank you very much.
Thank you. Thank you, sir. Bye
Thank
bye.
you. Thank you. Bye-bye. Thank you.